Again, I will repeat, is contraception. It is a high yield topic. Lots and lots of recalls are in this. I think out of 30 questions, 20 are recalls, and the rest I have tried to make clinical based questions or image based questions to help you understand. We will have discussions in between, and we will start in a minute. Okay. Are we good to go? Does anyone want me to wait, or should we start? Okay, so I think we'll start, right? Should I wait? Anyone wants to say something, or should we start? Okay, I think we'll start. Okay, start. All right. So good luck to everybody. The quiz is on contraception, previous year recalls, NEETPG pattern, INICET pattern questions. Okay, so starting. Okay. Identify this contraceptive. Easy question. Is it a cervical cap, a cervical diaphragm, a female condom, or a male condom? Okay, so this is a female condom. A cervical cap looks actually like a cervical cap. It is like how a menstrual cup looks like. It's a cap which covers the cervix. That's how a cervical cap looks like. I didn't have a picture, but you can go back and check. This is a female condom. All right. Okay, next. Let me just see this. Okay, yeah. Next. So scoreboard, Avinash on top, and the rest follow. Okay, next question. So time also matters. A 23-year-old has unprotected intercourse. She took one tablet of LNG 0.75 mg after 6 hours. When should the next dose be taken? These are all previous year recalls. Right. So this is the correct answer. So in emergency contraception, we can give LNG in two ways. We can give LNG is levonorgestrel. It is a progesterone which can be given in two ways. Either we give 1.5 milligram as a single stat dose. Okay. And that's what is given usually now. But we can also give it as a 0.75 mg tablet after intercourse. And the second dose has to be repeated after 12 hours. So all of you got this right. And I'm glad. And those joining in now, the pin, you can see the pin in the corner, 51222699. Please join in using this pin. So Pratham is on top and followed by the rest. Okay, next question. I think only 5 or 6 are playing. So you'll all be interchanging positions and it'll be good fun to watch. Okay, next question. Which of the following is avoided in a 23-year-old P1L1 with DVT who is already on warfarin? Depo-Provera, Implanon, LNG, IUD, or NuvaRing? This I had put on the group also, I think, a few days back as a question. Those joining in now on Zoom, the pin is down. You can read the pin, enter the app, and start playing. Okay, so surprisingly, okay, somebody's waiting in the waiting room. Okay, so those who are entering Zoom, we've started the quiz already. The pin is 51222699. Enter the pin and you can start playing. The quiz is on contraception, previous year recall questions. Okay, so anyone who has DVT, please remember, or who has a high risk of developing thromboembolism, what is contraindicated? What should we not give? Anyone? You can enter the chat box or unmute and say there are very few people anyway. What should not be given? What hormone should not be given as part of contraception? We should avoid what if the patient has thromboembolism or is at risk of thromboembolism? Yes, estrogen, right. So remember, estrogen containing contraceptives are OC pills, combined OC pills have estrogen. Also the Nuva ring and the transdermal patch also have estrogen. Okay, so remember this. So OC pills, apart from OC pills, what else contains estrogen? The Nuva ring and the transdermal patch. These are the three estrogen containing contraceptives. Depo-Provera has only progesterone. Implanon is a subcutaneous implant that has only progesterone. LNG-IOD has LNG, which is a progesterone. You can safely give progesterone in women who are at risk of thromboembolism, but you can't give estrogens. Remember, OC pills we can't give Nuva ring, that is the vaginal ring, and we can't give the transdermal patch. So remember, it's a very, very frequently asked question. Yes, good. iPhone is saying OCP plus Nuva ring plus Ortho-Evra patch because they all contain estrogen. All right, so it's a very important question. All of you should know this. Always a question comes related to this. Okay, slight change in position, cardiac is on top. Okay, next question. Those entering the quiz now, you can enter the pin and start playing. Dose of LNG used for emergency contraception is. So I already told you the answer, but you can quickly answer this. This is also a recall. Okay, so everybody answered so quickly, 5 seconds, and everybody got this right. So I'm very glad. Okay, cardiac is on top, positions remain the same. Okay, next question. All of the following are reversible LARCs, long-acting contraceptives, long-acting reversible contraception, except which is not a LARC method. This is also a previous INICET question. Yes, so obviously laparoscopic tubal ligation is obviously not irreversible. Okay, it's actually a misnomer. You can reverse it, but for all practical purposes, it is irreversible. So LARC, this again is a controversial question. What comes under LARC? So RCOG says that the injectable comes under LARC, the subcutaneous implant comes under LARC, and the intrauterine device comes under LARC. But ACOG says injectables don't come under LARC, only the implant and the intrauterine device. RCOG defines LARC as any contraception whose frequency is more than once a month. You don't have to repeat it more frequently than once a month. So that is what a long-acting reversible contraceptive is. Okay. So the scoreboard is the same. Okay, I'm glad. Next question. This instrument is used in which procedure? This is also a previous year question. And I plan to do a reel on this tomorrow, if I get access to this instrument. Okay, so this is what is this instrument? Can anyone tell me the name of this instrument? The 4 of you who got this right, what is the name of the instrument? Anyone? Anyone? Okay, so this is an instrument used for laparoscopic tubal ligation. It is called a laprocator. Okay, it is used, so we load the fallope rings, the small tiny rings which are used to occlude the fallopian tube. We load them at the tip of this instrument, and then we open, when we grab the tube and press the button, the ring goes and occludes the tube. So I'm trying to get hold of this instrument so I can do a reel on this. It's commonly asked. Okay, so this is used for laparoscopic tubal ligation. It's an applicator for fallopian, correct? It's called a laprocator. It's actually a laparoscopic applicator. That's why it's called a laprocator. All right. Okay, next question. Okay, someone's entering the waiting room. So those who are entering the Zoom, please enter the pin. The pin is at the bottom, 51226999, and then you can start playing the quiz. You can join right in the middle. It doesn't matter. Okay, cardiac still on top. Akash, Asherman have moved up. Okay, next question. A woman is on Mala N for contraception. At the end of the first strip, she did not get her period. The next best step is also a repeat question and an easy one. ask her to do a UPT. So it could be the most common thing you would think of is failure of contraception. That's the first thing you should strike. That should strike someone. A woman on reproductive age group using contraception comes with a missed period. Any contraception, think of a pregnancy. Okay, next question. I think everybody's position, slight change in positions, but everybody got this right. Okay, next question. All of the following are contraceptive methods used for post-coital, except which is not used post-coitally. This is also a previous year recall. Okay, right. Dan is also, everybody's answering the questions are very easy. There will be some difficult questions which I've made in the end, but let's wait till then. So yes, so postcoital means emergency contraception. So we can use combined high dose E plus P, we can use progesterone, we can use ulipristal acetate, we can use an intrauterine device, we can use mifepristone. What can't we use? We can't use danazol. Danazol is used for things like endometriosis, mainly for endometriosis. It is now not used as an emergency contraception. Okay. So again, just a slight shift in positions. Cardiac remains on top. Okay, next question. What is the dose of ulipristal acetate for using as an emergency contraceptive? Is it 0.3 milligram, 3 milligram, 30 milligrams, 300 milligrams? So these sort of questions are there to confuse you, but this is also a previous year recall. Also, it's not available in India, so I don't know why they ask such questions. They're just to trouble you, I guess. Yes, most of you got this right. It is 30 milligram. It's available. It's available in different doses because it has two main uses in gynecology. Remember, one is an emergency contraception. The other two, it is also used in. Can anyone tell me where else do we use ulipristal? It has recently been banned in some countries also by the FDA because of the risk of liver toxicity. Okay, fibroids, Avinash, very good. So it is still in use in some countries for a short period of time. For 3 months, it can be used to medically manage fibroids. It reduces the size of the fibroid in a much lower dose. But for emergency contraception, it is used as 30 milligram as a single tablet. And for this purpose, it is still not available in India. Okay, increased risk of hepatotoxicity and liver transplant, iPhone. Yes, correct. Okay, that's why it's banned in some countries. Okay. Positions remain the same, cardiac remains on top. Okay, next question. OC pills have protective role against all of the following except endometrial cancer, ovarian cancer, osteoporosis, and thromboembolic events. So this is also, we've discussed this already, so it's again an easy question. Yes, okay. So remember, OC pills have protective action against ovarian cancer and endometrial cancer. Okay. But they also have protective effect against osteoporosis. What cancers can they cause? That we will come to later once the other questions are also covered. But yes, they should not be given in thromboembolism. If the woman has a history of thromboembolism or is at risk of thromboembolism, because the estrogen containing component will increase her risk. So it should not be given in women who have a risk of DVT. Okay, next question. Okay, positions remain the same. Next question. All of the following represent mechanism of action of POP, progesterone only pills except. This is also a previous year question. The first 20 questions are all previous year questions. Okay, correct. So it delays the fallopian tube motility. OCPOPs mainly act by causing cervical mucus thickening and endometrial atrophy. These are the two primary actions. It also suppresses ovulation because if you give the woman continuously progesterone, ovulation will be suppressed. Okay, but for OC pills, that is the main mechanism of action. What it doesn't do, it doesn't enhance fallopian tube motility. It in fact slows down fallopian tube motility. All right, so I think a slight change. Ashraman goes down, cardiac remains on top. Okay, next question. Which of the following has the lowest pregnancy rates? Again, previous year question. Copper T 380A, Copper T 200 multi-load, or Novoty? Okay, sorry. So, yes, the answer is Copper T 380A. That's the correct answer. This is the least pregnancy rates, followed by multi-load, followed by Copper T 200, followed by Novoty. Okay, so remember, Copper T 380A also freely available by the government of India. Okay, this Copper T has the least pregnancy rates compared to all the other Copper Ts. Okay, so this is something you have to remember. Okay, and it's been asked previously, so you have to remember this. Okay, next question. Which is incorrect regarding this contraceptive, which is incorrect? Quickly, more answers. Time is running out. Only 3 people have answered. Okay, yeah. So, right. So it can be given in women who have menorrhagia. In fact, Mirena is an LNG IUD, third generation intrauterine device. It acts also, all progesterone containing contraceptives cause endometrial atrophy. There is no doubt about that. Okay. It totally contains 52 milligram of LNG and releases 20 microgram per day locally. So it acts locally because it's an intrauterine device. It acts directly on the endometrium, and it is contraindicated in women who have menorrhagia. This is wrong. It is actually given in women who have menorrhagia, and that is why it can be given in women who have small fibroids, who have adenomyosis, who have AUB, endometrial hyperplasia. It can be given in all these women because it causes endometrial atrophy and reduces the bleeding. Okay, so no change in position. Okay, next question. All of the following are mechanisms of actions of OC pills except. So all of these are true regarding mechanism of action of OC pills except. Again, an easy question. Again, a previous year question. So contraception is one area where you can score really well because it is definitely going to be asked, and there are very limited questions you can get on these. Okay, so yes, it doesn't interfere with placental functioning, obviously, but it mainly acts by suppressing ovulation, interfering with implantation, and actually prevention of fertilization. Okay. So I don't think, okay, slide change, Avinash on top, cardiac goes to number 3. Okay. Which of the following intrauterine devices has the longest lifespan? Okay, so this is longest lifespan, not failure rate, which has the longest lifespan. Yes, Copper T 380A. Remember, those of you got this wrong. 380A is the one which is freely available in the government of India, or wherever you work, whichever medical college you are in or you have been in. Jo Copper T, which is commonly used in the OPD, that Copper T is Copper T 380A, which has 10 years. The lifespan of Copper T 380A is 10 years. Of multi-load, Copper 375, multi-load, what is commonly called as multi-load, that is 5 years. Okay, so remember 380A is 10 years and the rest are 5 years. Okay, so someone has entered the Zoom waiting room. Whoever's entered, to play you need to log on to the Kahoot app and enter this pin 5122699 at the bottom right corner, and you can start playing. Okay, Gynefix, Avinash asking, I'm not too sure, I need to check, but it's I think it's between 3 to 5 years. Let me just check. But Copper T 380A is 10 years, and all the rest, there is nothing which is beyond 10 years. All the rest are 5 years or less. There is nothing even between 5 to 10 years. Okay, but Gynefix, let me check. What is the special characteristic of Gynefix? Anyone can tell me? Gynefix is also called it's also called a frameless intrauterine device. It doesn't have that plastic frame. Okay, and in the end, it has sort of an arrow. When you insert it, it goes and sticks or sort of embeds itself in the endometrium. So it has the least rate of expulsion. Remember, Gynefix has the least rate of expulsion. It is a frameless IUD. sort of goes and anchors itself in the endometrium when it is inserted. It has an arrow at the top. So also I had put on the group a while back a short audio image of copper T's. You can go through that. That will give you the exact lifespans, and I'll check and I'll put on the group again for those of you who missed that audio image. That is all about copper T's. Okay, next question. Okay, I missed the scoreboard, sorry. Emergency contraception freely available by the government of India contains what? Emergency contraception freely available contains what? Okay, quickly answer. Yes, so remember, use-based regime is not what the government of India gives. The government of India gives e-pill. It's called by the name e-pill, that is emergency pill, and it contains 1.5 milligram of LNG. So you should all know what the government of India freely gives. What does it give in the, can anyone tell me a list or just unmute or write down what does the government of India give free? Because you will always get questions on this. In intrauterine devices, what does it give freely available? I just told you it gives copper T 380A, and also now in some areas multi-load 375 also the government of India is supplying. Okay, someone's writing on the chat box. Yes, e-pill, correct. That is emergency pill. Antara and Saheli, very good. Can you tell me what is Antara? You should know these names. What is Antara? And what is the new name of Saheli? Yes, Saheli is Centchroman. Yes, agreed. Good iPhone. So the new name of Saheli is Chaya, and Chaya contains Centchroman. What does Antara contain? Antara is depot medroxyprogesterone acetate. Very good, Ashman. So the injectable contraception DMPA is available as Antara, good iPhone, and Chaya is earlier called as Saheli is Centchroman. Okay, also Mala N, Mala D. These are also available. Mala N actually is available freely by the government of India, and also the male condom Nirod. So these are the ones which are freely available, and these you should know because you usually get a question as part of PSM or as part of gynae, and one of these will be asked. Okay, so you should know these, especially Antara Chaya. These are two new things which you should know. I'll repeat. Antara is DMPA, injectable progesterone, and Chaya is earlier called as Saheli is Centchroman. Okay, next question. Okay, so slide change. Asherman goes to number 4. Akash moves up. Okay, next question. A 28-year-old is started on OC pills. She misses 4 tablets in the first 2 weeks and comes for advice. Which is the next best step? Okay. So this came in the last NEETPG. The question was longer, but it couldn't fit, so I put it here in a short form. Yes, okay. So I'll just quickly show you the slide on this because this is a very important question. Okay, so this was the question. This was the exact question which came in NEETPG. Reema Devi, a 28-year-old newly married woman, presents to your sub-center for contraceptive advice. And I know this is the exact same question because I actually wrote the NEETPG exam last year to get the exact recalls. Okay, so she started on OC pills. She presents after 2 weeks with a history of missing 4 tablets on different days in the first 2 weeks of the cycle. What will you advise her? Okay, and the correct answer is C. What is C? Take the next pill as soon as possible, continue the remaining packet, use a condom, and give emergency contraception if history of intercourse in the last 72 hours. Okay, now don't get confused. Okay, it's actually very simple to understand. So this is the concept. What should you do? 1 second. If a patient misses a pill, so if there is one missed pill, what should you do? If the woman misses 1 pill, so this is a very commonly asked question and you should know what to do. The missed pill should be taken as soon as possible. The woman comes to you, she's been taking the OC pills 21 days and she comes to you and she says, I missed one of the hormonal pill, not the iron tablet. Iron tablet, if she misses, nothing needs to be done. Okay. But if she misses the hormonal tablet, tell her to take the missed pill as soon as she remembers. Okay. And then continue taking the remaining pills as usual and no additional contraception is required. But if she misses 2 or more pills, that is, she is more than 48 hours late. She forgot one today and she forgot her yesterday dose also. And then she comes to you and says, now what do I do? So what should you advise her? You don't have to take all the 2 tablets, or if she's missed 3 tablets or 4 tablets, you just have to take the last missed pill. So whatever tablet she forgot today, that has to be taken. Leave the earlier missed pills. Forget the remaining. Jitne bhi usne miss kiye, forget those. Use additional contraception for 7 days. So ask her to use a condom for 7 days. And then you can also advise her any of these 3 steps to further reduce the risk of pregnancy. If the pills were missed in the first week, then consider emergency contraception. If the pills were missed in the second week, there is no need for emergency contraception. And if the pills were missed in the third week, that is the last week of the contraceptive, then omit the pill-free period and start a new packet immediately. Okay, I hope this is clear. Some doubts, I think, on the chat box. How many maximum number of pills can be missed to continue the same packet? Good question, iPhone. Wait, Avinash, take the next pill ASAP. Okay, so there is no number, iPhone, there's no number which has been said, but of course, the more number of pills she misses, the higher the chance of her getting pregnant. So that's why all these steps are taken. So the guidelines are for 2 or more missed pills. It could be maybe even 10 missed pills. Obviously, her risk of getting pregnant becomes higher, but this is what needs to be done. Also, apart from this, counsel her that yes, you can still become pregnant. Okay. So this is what needs to be remembered. It's a very important question. It had never been asked before. It was asked in the last NEETPG, so it becomes very important. Just hold on for a minute. One second, I'm just trying to go back to the Kahoot again. Yeah, sorry. It was not going otherwise. Okay. Right. So I hope this is clear. Any doubts in this? So in this patient, if she's missed 4 tablets, what will you do? Ask her to take not the next tablet, actually the tablet she missed ASAP, continue the remaining packet, use additional contraception, and take an e-pill, especially if the pills were missed in the first week. If the pill was missed in the second week, then nothing extra needs actually to be done. But if the pills were missed in the third week, then omit the pill-free interval and start a new packet immediately. So A is asking, more than 2 pills missed, always EC advised, or only if missed in the first week? If missed in the first week, then you advise EC, not always. Preferably. So these are additional steps to be taken. Only in the first week, if it's missed, then EC. In the second week, you don't have to advise an emergency contraception. That is the guidelines. Okay, so we will start her on a new pack if she misses in the third week. Yes. So I tell her, so normally how do you advise OC pills? You give 3 weeks OC pill, 1 week off, then 3 weeks and 1 week off. So that 1 week off period is omitted if she misses a pill in the third week. Okay. And these guidelines are only for pills which more than two or more pills which have been missed. A single pill has been missed, just advise her to continue. Take the tablet as soon as she remembers and continue. Okay, so this is what needs to be remembered. Very, very important concept, which I thought I would tell you. Okay, sorry, my video is also off. Okay, next question. So let's see the scoreboard. Okay, cardiac, same positions, cardiac on top. Okay, next question. A 30-year-old woman started on ATT for pulmonary TB. She was on OC pills for contraception and has been advised to change the method. Why? This is also a NEETPG question last year. Pharmacology plus gynae, sort of an integrated question. Yes, rifampicin induces metabolism of OC pills. Most of you got this right. Okay, also, which other drugs induce metabolism of OC pills? Can anyone tell me? Important. If a woman has what problem should you think of this? If she is taking phenytoin, good. So anti-epileptics, not only phenytoin, phenobarb, carbamazepine. Okay, yes, okay. Smoking, alcohol, yes. And rifampicin, very good. Okay, which anti-epileptic should you not give if a woman is on OC pill? The other way around. OC pills increase the clearance of which anti-epileptic? Ulta question. Okay, and valproate, right. But I'm asking the ulta question. OC pills, estrogen induces the clearance of which increases the clearance of which anti-epileptic? Which anti-epileptic should you not advise, because the serum level of that anti-epileptic will go down if the woman is on OC pills? Homework. You will all read up and tell me which anti-epileptic should not be given. Just a minute, I'm getting a call from hospital. Just a second. Not sodium valproate. Okay, think and tell me, or read up and tell me, and let me know on the group, or let me know separately. Okay, next question. Okay, so Akash has a higher streak, cardiac remains on top. Next question. This can be used in all except. Again, the one we've asked earlier. This can be used in all except. Yes, Asherman, you're right. Yes, so asymptomatic fibroid uterus, because it's asymptomatic, it doesn't, you don't need to use a Mirena or a LNG iodine. Adenomyosis you can use, in endometrial hyperplasia you can use, as contraceptive obviously you can use. In asymptomatic fibroid uterus you don't need to use. In fibroids which distort the cavity also, an IUD is not used. Okay, so and the previous question which I asked, Asherman is right. Lamotrigine is the anti-epileptic which should be used in caution, or should not use it anti-epileptic in women on OC pills, because OC pills increase the clearance of lamotrigine. Okay. So Avinash moves up by 1 point, cardiac remains on top. Next question. 19-year-old unmarried nulliparous girl who is sexually active wants to know about contraceptive options which cannot be given. Which cannot be given. Yes, ulipristal. Okay, no one got this right. Okay, so why can't the contraceptive ring be given? She's sexually active. She can use the ring. Ulipristal acetate is only for emergency contraception. It is not to be used as a routine contraceptive. We should never advise emergency contraceptions as routine contraceptive, especially in the adolescent age group. Okay, so in adolescent age group, you can use all of these. You can use Depo-Provera, you can use the ring, you can use the patch, you can use the OC pill, you can use implants, you can use even intrauterine devices you can use. In fact, in the West, intrauterine devices are commonly prescribed even for nulliparous girls. Only in India, the government of India says she should at least have one child before advising an intrauterine device. But ulipristal acetate is an emergency contraception. It is not to be used routinely. Okay. So does that change a bit? Yes. So Akash moves on top because I think he answered correctly. Okay, next question. A 23-year-old woman is using the patch, complains of partial detachment of the patch for more than 1 day. What will you advise? So more than 24 hours, the patch has been detached partially. So what will you advise? This is a newer contraceptive. I'm glad most of you answered this right. Okay, so the patch is now available in India. So you can get questions on this also. And this is a very common complaint women come with. The patch, if it gets detached partially or completely for more than 24 hours, it should be discarded. A new patch should be used and use additional contraception. Usually we advise a condom for 1 week. But if the patch, if one second, am I right to reply to user column? Yes. Okay, so if the patch was detached for less than 24 hours, then you don't have to advise additional contraception. She just has to replace the patch. So additional contraception is advised if the patch has been detached for more than 24 hours. Okay, so people are joining in now also. Whoever wants to play can still play. Yes, composition of patch is estrogen plus progesterone. Okay, the exact composition I'm not sure, but definitely ethinyl estradiol, the progesterone I have to check. The patch contains which progesterone. Yes, patch, remember, patch, ring, and oral contraceptive pills, all three contain estrogen plus progesterone. Okay, so those who are joining in now, please enter the pin and you can start playing. Yes, iPhone, norelgestromin, you're right. And I think the ring contains etonorgestrel, ethinyl estradiol plus etonorgestrel, if I'm not mistaken. Yes, okay, right. Okay, so etonorgestrel is in implanon, etonorgestrel is in the vaginal ring, and as iPhone has said, the patch contains norelgestromin and ethinyl estradiol. So the estrogen component always remains the same. It is always ethinyl estradiol. The progesterone component changes depending on the type of OC pill or the patch or the ring. Okay. Slight change, Avinash moves to number 2. Okay, next question. All of the following can be used as a contraceptive in a lactating mother except. Okay, quickly answer. This should be an easy question. Yes, again, for the same reason, estrogen, remember, wherever there's estrogen, it should not be given in a woman who's lactating because it reduces the amount and the quality of breast milk. Same, estrogen should not be given in a woman who's at high risk of DVT. These two things you should remember. Estrogen should not be given in lactating women. It should not be given in women at high risk of DVT. The Nuva ring contains estrogen, so it should not be given in lactating women. Implanon contains etonorgestrel, which is a progesterone. Mini pill contains desogestrel, which is a progesterone. That is the progesterone only pill. And LNG-IOS contains levonorgestrel, which is again a progesterone. These can all safely be given in lactating women. Implanon is used nowadays, yes, Avinash, but not in our country. If you go to countries like Nepal, so Nepal, like we have copper T380A as the government initiative. Nepal has Implanon as their government initiative. Every woman has a subcutaneous, not every woman, everyone who wants contraception is given usually a subcute implant. So it depends on the country you're in. Okay, so in Nepal, you'll find copper teas are very expensive. I'm telling you this because I've worked in Nepal for some time, so I know how things are there. But every patient has, you'll find Implanon very, very commonly used. Like how we teach interns how to insert a copper T and remove a copper T, there we teach interns how to insert an implant and how to remove an implant. It's that common. Okay, so yes, it is used, but not common in our country. Okay, in the West, it's common. In some other countries, it is common. Okay, cardiac remains on top. Okay, next question. Which is not a non-contraceptive benefit of OC pills? So amongst the non-contraceptive benefits of OC pills, which one is not a non-contraceptive benefit? Yes, okay, we all know this is a simple question. Diabetes obviously will not be prevented. Ovarian cancer, endometrial cancer, osteoporosis, menorrhagia, dysmenorrhea, anemia, all can be prevented. Okay, so yes, cardiac remains on top. Avinash, Akash follow. Okay, a 38-year-old is using LNG-IOS for contraception. After 6 months, she complains of irregular spotting. What is the next best management? Colposcopy, remove the LNG-IOS, reassure the patient, or ultrasound for endometrial thickness? Okay, so the first thing you will do is reassure the patient, because this is a common, very, very common side effect of LNG-IOS is irregular bleeding. In fact, of all progesterone containing contraceptives, the Depo-Provera, the subcutaneous implant, irregular bleeding will be seen. So the first thing we do is reassure. However, if it is persistent, then we need to evaluate the patient. We need to do an examination, examine the cervix, take a pap smear, and yes, do ultrasound for ET. But here the next best management is just to simply reassure the patient. Okay. This will lead to a slight change. No. Okay. So everybody remains the same. Okay. Last 5 questions, I think. The typical failure rate for this contraceptive is? Wait. Okay. Some doubts are there. So Marina is 0.1%. Okay, you need to remember that. Okay, so Avinash is saying by 1 year, amenorrhea sets in. Amenorrhea will set in by 1 year. In the beginning, the most common side effect is irregular bleeding. And then amenorrhea sets in 80% of women after the use of 1 year, not 6 months. Okay. Okay, 0.1% is correct. Most of you got this right. Okay, Avinash on top, followed by cardiac. Okay, next question. Identify the type of tubectomy shown. Is it Madliner? Is it Parkland? Is it Pomeroy? Is it Uchida? Yes, this is Pomeroy's method. This is the most common type of method done in our country. This is the type of method advised by the government also in the guidelines. Pomeroy's, where we take a loop of the fallopian tube like this, and we put a ligature here, and then we cut off around a 2 centimeter length of the tube. So this is Pomeroy's method. The other methods, I will explain to you separately. I am in a little bit of rush. I have 5 questions. I will quickly finish this, and then I will share the pictures of the other methods on the group, if that's okay. All right. Okay. So Avinash remains on top, followed by cardiac. Okay. Next question. A contraceptive is used by 100 couples for a period of 2 years. 20 women become pregnant. What is the Pearl index? ये मैंने PSM से उठाया ये question. And I've given 1 minute to answer. So sit and calculate. Okay, you should know the formula to answer this. Okay, if you don't, I will tell it to you. Okay, so the answer is 10 per 100 woman years. HWY is 100 woman years. Here's what is Pearl index. Pearl index is the number of, it is basically to calculate the failure rate of a contraception, and it is per 100 woman years. So what does this mean exactly? So just you need to remember the formula. The formula is, I'll also need to write it down to explain to you. So basically it is the number of accidental pregnancies. So here, what is the number of accidental pregnancies? The accidental pregnancies is 20, right? So 20 into 100 woman years. So that is basically 12 into 100. So 1200. So 20 into 1200 is the denominator, is the numerator, and the denominator is the number of total women, that is 100 couples, and into the number of months you are observing that contraception being used. So that is 2 years, which is 24 months. I will repeat, the number of accidental pregnancies into 1200 divided by the number of people or patients observed into the number of months observed. So if you use this formula, you will get it easily. 20 into 1200 divided by 100 into 24. So this comes out to be 10. Remember this, it is occasionally, it has been asked. I think only once it's been asked, but it can be asked. The Pearl index is a very important. Okay, so yeah, so iPhone is writing accidental pregnancy divided by total number of women using this method, years of exposure into 100. Correct, right, iPhone. So this, if you use this method, it comes out to be 10 per 100 women years. For those who have not understood, I will write down this formula in the group or in the PDF I share. But remember this formula, it can be asked in your exam. It is more of a PSM question though, but I put it here also. Okay, so cardiac on top, followed by Avinash. Okay, next question. Identify the progesterone component in this contraceptive. I think I already gave you the answer earlier. Okay. What is the progesterone in this contraceptive? This is the Nuva ring. What is the progesterone? Yes, etonorgestrel and Nuva ring. Also in Implanon, it is etonorgestrel. Okay. Next question. Most of you got this right. Cardiac, Avinash, Akash, Ashraman, Pratham has a streak of correct answers. Okay. Next question. What are the components of this contraceptive? Easy question. Mala N, what does it contain? Last three questions. Yes, it contains levonorgestrel plus ethinyl estradiol. Okay, so all estrogen containing contraceptives contain ethinyl estradiol. Mala N contains LNG. Where else do we see LNG? In the Mirena. Okay, and ferrous fumarate. Ferrous fumarate is the iron tablet which Mala N contains. Okay, important question. Okay, so remain the same. The positions are the same. Last two questions. What is the earliest time when breastfeeding women can start taking POPs after delivery? After 6 weeks, immediately after giving birth, after 6 months postpartum, or she can't, what's written? She cannot start POPs while breastfeeding. What's the correct answer? When can she start progesterone only pills after delivery? She can start immediately after giving birth. So on day 1 itself, you can start her on POPs. It has no side effects. It will not reduce the breast milk. It will not affect her lactation. So she can start it immediately. She can start at 6 weeks postpartum also. But the question asks, what is the earliest time? So usually we advise to start 6 weeks postpartum. But what is the earliest time when someone asks? It can be started even immediately after giving birth as per the WHO. Okay. Okay, next question. Does this change? No change in the scoreboard. Last question, I think. The dose of this contraceptive is Centroman, Chaya. What is the dose of this contraception? Yes. Okay, OC pills after 6 weeks. Yes, Avinash, if she's not breastfeeding, then you can start OC pills after 6 weeks. But if she isn't, you're right, iPhone, if she isn't lactating, then you don't start OC pills immediately, because a pregnant woman is at risk of thrombophilia or DVT, especially after a cesarean. POP was 3 weeks later. Yes, but the question asked was, how soon can you start? You can start immediately after birth. Okay, we usually advise a woman not to have intercourse, all this after, but if the question is asked, how soon can you start? You can start immediately after birth also. Okay, this is the correct answer. Centroman is taken twice a week for the first 3 months and then once a week after the 13th week. So that's the correct answer. All of you got this right. So let's see the scoreboard. So 22 right questions is Akash, congratulations. 27 right questions is Avinash, congratulations. And 26 right questions, okay, is cardiac. So I think cardiac answered quicker, but otherwise very close. Cardiac and Avinash. Runners up are Asherman and Pratham. Congratulations. Thank you so much for taking part in the quiz. I will come out with the PDF maybe by tomorrow morning. Okay, so you can go through that also. But thank you very much for participating. Okay, so any questions? Okay, I'm sorry, I have to go somewhere, so I have to leave. Okay, thanks, iPhone. Thank you very much. Thank you. So next quiz, I'll let you know, it'll either be on labor, because that's a long-term pending topic we've had, or oncology. These are two very, very high yield topics. We want to finish them before in this month itself, oncology and labor. So these, one of the next quiz will be based on one of these. Okay, thank you everyone. Good night.